We're going to dive into something pretty wild today. We're exploring this surprising, almost unbelievable connection between the food you eat and, well, how you breathe. It turns out what's on your plate can directly cause fluid to build up around your lungs. It's a fascinating link that just shows how powerful our diet really is. So let's get into it.
So let's just get right to it. Can the stuff on your plate literally cause fluid to build up around your lungs? I mean, it sounds kind of out there, right? But the connection is way more direct and powerful than you might think.
The answer? It's a surprising and pretty resounding yes. And over the next few minutes, we're going to break down exactly how this happens. We'll look at the common culprits, and then get into some truly extraordinary cases where food, or even the lack of it, becomes a life-saving therapy.
Okay, so to really get this, we've got to talk about the body's plumbing system and this condition called pleural effusion.
I want you to think about your body's fluid management system like a sink. Pleural effusion, that's the fluid in the chest. It's basically like that sink overflowing. The faucet is all the fluid and salt you're taking in. The pipes are your blood vessels carrying everything around. And the drain, that's your kidneys and your lymphatic system, working to clear it all out. If you have a problem with any one of these parts, you're going to get a flood.
So where does your diet come into all this? Well, there's this great way to think about it. Food can act as a biochemical scriptwriter. It's not just a passive thing. It's actively influencing the whole drama of how fluid balance plays out in our bodies.
All right, so who are the usual suspects in this script? Most of the time, the story really boils down to two key players, salt and protein.
And they have totally opposite roles. On one hand, you've got sodium. It's basically a water magnet. The more salt you eat, the more water your body holds onto, which is like turning that faucet on full blast. Then, on the other side, you have protein, specifically a protein called albumin. It acts like a sponge inside your blood vessels, using this thing called oncotic pressure to hold water inside the pipes and stop them from leaking.
So let's look at a real-world example, congestive heart failure. In CHF, the heart's pump is weak, so fluid starts to back up. The dietary fix? A low-sodium diet to turn down that faucet and reduce the total amount of fluid in the body. And at the same time, making sure there's enough protein to keep that vascular sponge nice and strong, which helps prevent those leaks in the first place.
It's a similar story with liver cirrhosis. Here, you get high pressure building up in the abdomen, which can literally force fluid up into the chest. So again, a low-sodium diet is key to manage that fluid. But here, protein does double duty. It supports that vascular sponge, and it helps the liver try to regenerate itself. Now, with chronic kidney disease, it's a different problem. Here, the drain is basically clogged. The kidneys just can't filter everything out. So diet becomes a real balancing act. You have to restrict both sodium and fluids to prevent the whole system from getting overloaded. And protein has to be very carefully controlled, enough to keep the sponge working, but not so much that it overwhelms the already struggling kidneys.
All right, so we've got salt and protein down, right? The water magnet and the sponge. But what happens when the problem isn't about the main water pipes at all? Sometimes this whole story takes a wild turn, and the real culprit is fat.
And that brings us to a totally different kind of clog, a really unique condition called chylothorax.
So it turns out your body has a whole separate drainage system just for dietary fats. It's called the lymphatic system, and the milky, fat-rich fluid that flows through it is called chyle. Chylothorax is what happens when that special fat drainage system springs a leak and all that fatty chyle spills directly into the chest cavity. This is seriously dangerous because you're losing vital fats, proteins, and vitamins with every drop.
The key to treating this is understanding that not all fats are the same. See, long-chain fats, which make up most of the fat in our diet, they travel through that leaky lymphatic system, so eating them just makes the leak worse. But then you have medium-chain fats. These guys are special. They actually bypass the lymphatic system and go straight to the liver. This gives that leaky pipe a chance to rest and heal.
So the game plan here is super logical, right? It's a step-by-step thing. Step 1, you put the person on a diet that's super low in those long-chain fats to reduce the flow of chyle, and you pump up the protein to make up for what's being lost. Step 2, you watch that chest drain like a hawk for a week or two. If that's not enough to fix the leak, you escalate to Step 3. Stop all oral feeding completely and give nutrition through an IV. You give the whole system a total rest.
Now, this is super important to get. This is a serious medical diet, okay? Not some fad you try at home. When you restrict fat this much, there's a real risk of becoming deficient in essential fatty acids and those fat-soluble vitamins, A, D, E, and K. So this has to be done under careful medical supervision with exactly the right supplements. So we've seen how changing what you eat can be the solution. But what if I told you that in some of the most extreme cases, the cure is actually to stop eating altogether?
And the connections don't stop there. Take pancreatitis. Eating high-fat foods can stimulate the pancreas and make fluid leaks worse. Or severe celiac disease, where gluten damages the gut so badly that you lose protein, making your vessels leaky. And here's a wild one. In severe malnutrition, feeding someone again too quickly can paradoxically cause fluid to build up. And every one of these, diet is a huge factor.
But the most intense, the most dramatic example of this has got to be a condition called an esophageal pleural fistula. This is where a hole literally forms between your esophagus, your eating tube, and the space around your lungs.
This is a 5-alarm fire, a true life-threatening emergency. Every single time the person swallows anything, food, water, even their own saliva, it leaks directly into their chest. This causes a massive, overwhelming infection. The very act of eating becomes toxic.
And that leads us to the ultimate mind-bending dietary paradox. The only way to stop the contamination and give the body a chance to heal is to stop all oral intake, period. In this incredible scenario, the best, most life-saving feeding is no feeding at all.
So when you step back and look at it all, diet is just unbelievably powerful, isn't it? From managing sodium and heart failure, to rerouting fats for a child leak, all the way to complete fasting for a fistula, the food we eat, or choose not to eat, writes a complex and powerful story that medicine absolutely has to learn how to read.
And that really leaves us with this powerful idea to take away. The next time there's fluid in the chest, maybe the question isn't just what caused the leak. The question we also have to ask is what fed it? Understanding that connection, well, that's key. Thanks for joining me on this one.